This is Kate Warnock here with the Honorable Patrick Kennedy, former congressman and founder of the Kennedy Forum. Mr. Kennedy, how are you today?
I'm good. Thanks, Kate.
So we're here at the kickoff of Emerging Minds, illuminating the path to mental wellness. And I can't think of a better person to ask than Patrick Kennedy about the current state of the mental health crisis here in the United States. Can you kind of frame it up for us?
Well, for one thing, we've neglected taking care of the brain. We don't cover brain illnesses in the same way we cover other physical illnesses. At least we haven't ever until we passed the Mental Health Parity and Addiction Equity Act. But even after passing that in 2008, trying to enforce it has been very difficult. Most payers do not disclose how they employ medical management practices, and so it's very difficult for us to make a comparability to the treatment of medical and surgical so that we can understand whether there's equal treatment of people with mental illnesses in the same way we treat any other illness. And so this is really about trying to break the old patterns of discrimination that was born of different attitudes that believed that mental illnesses were really character flaws, that they were somehow moral failings as opposed to medical failings. So it's about an attitude adjustment, but until we get an attitude adjustment, we have to change the actual practice of discrimination, and that's what we do at the Kennedy Forum. Is we have a parity track which evaluates each state's compliance with the parity law. That means how much do they enforce? How much do they employ better regulations? What's the case law? So this is like very esoteric stuff to the average person, unless it's your family member who's being denied access to mental health and addiction treatment. Now, the consequences of ignoring mental health for so long is that we have no mental health system that can be brought to scale to meet this emerging public health crisis. We have suicide in this country that continues to rise. It's twice the rate of homicide. We have an overdose crisis that now is killing more people than both homicides and car accidents. This is a public health epidemic. We're seeing whole demographic groups in this country, their life expectancy is going down simply as a result of both overdoses and suicides. This is startling a wake-up call to our medical system that we can no longer ignore that mental health and addiction is an essential part of what we consider health care, and that as health plans develop what they're going to do to address this medical crisis, they need to be sure to have mental health really in the DNA of what they consider to be health care.
All right, so Patrick, there's so many issues, and you just outlined so many barriers to care, deaths of despair, the health system not being adequately staffed even to help all these people, that we realize that mental health is equally important to physical health. Given all of those issues, though, what to you is the single largest barrier to mental health treatment really being what it should be today?
So the greatest barrier, as I said, is attitudinal. It's the neglect of people with these illnesses. If these were people dying of Ebola or Zika, we would be declaring the national emergency that this public health crisis of addiction is, or this public health crisis of suicide. We have this attitude that these people brought it on themselves if they've chosen to live this life. And as someone who's in recovery from addiction myself, I can say no one chooses to wake up every day and live with active addiction. It is a physical illness. It's a mental compulsion. It's hard to break unless people get the proper treatment. And that's what we need to do. We know what to do. We just now have to get about doing it.
All right. So being the advocate you are, the schedule that you maintain, and you're several years into your recovery, I was wondering if you could share with us, what is it that you do personally to help you maintain that balance of mental and physical wellness?
Well, first, I'm very fortunate I have an addiction psychiatrist to make the distinction between psychiatry and addiction psychiatry. We need addiction specialists because it's not taught in medical schools. Even for those who have the specialty of psychiatric training, often that excludes real training in addiction medicine. So I have an addiction psychiatrist who monitors my medications for bipolar. And then I go to 12-step recovery. I also try to live a healthier life by, having supports within my social network and, certainly trying to stay healthy physically. It really makes a difference on your brain if you're able to do those kinds of things that release stress.
Sure.
And and I've got an incredible family, and having that personal connection to loving community is so critical. One of the characteristics of having these illnesses is that you alienate yourself from everyone that you're close to. Part of recovery is connecting yourself, developing relationships of intimacy so that you're no longer left feeling so alone. Those alone feelings can be real early risks for relapse. And so being conscious of what is a relapse type situation allows you to try to navigate and think about ways to avoid those potential risks for relapse. So much of this is cognitive behavioral therapy, if you think about it, because that is the evidence base for mental health, is cognitive behavioral therapy, often paired with medication. And 12-step recovery is really cognitive behavioral therapy. It's about envisioning and trying to break old patterns of behavior by acting in new ways. You start to think in new ways. So I'm blessed to be in recovery. I really feel very, very fortunate, and I know that I have to do something to help others achieve recovery themselves, because I can support my recovery if I help others get recovery.
Absolutely. Well, we at Guidewell are so fortunate to have you here and the advocate that you are. We're so grateful for your time.
Thank you, Kate.
And happy that
Appreciate
you're
it.
going to be a keynote for us here in the day one of Emerging Minds. So thank you again. This is Kate Warnock.